नॉर्मल ड्रग्स पर होते हैं, उसके बावजूद अगर if they get any stress, शुगर अप चली जाती है. So what is a pathology like contribute to that?
Yeah, that's a very good question, and I'll answer that in the end. Okay, so the criteria for testing for prediabetes in asymptomatic adult individuals. Before you develop diabetes, you are completely asymptomatic, and even in the beginning stages, there are no symptoms. So people don't know that there is something wrong. So when do you want to check somebody for prediabetes or diabetes? So if you see any overweight adults, BMI over 25, and I will say BMI over 23 for South Asians, if they have any risk factors like physical inactivity, first degree relatives with diabetes, if they have high risk race, ethnicity, of course, that applies to the Native Americans and other ethnicities as well. And any women who have delivered a large baby. So that's one of the complications that happens with diabetes. They have macrosomia or large babies. They may often require cesarean sections, which complicates further. It causes maternal and fetal complications. And if they have high blood pressure, if they have low good cholesterol, if they have a high triglyceride level, or any other signs that they may have increasing insulin resistance. One of them is a skin condition called acanthosis nigricans, where you have increased pigmentation in the skin. It's usually around neck and in your armpits. If results are normal, then we should check it again in 3 years. And if they are bordering to abnormal, you might want to check more frequently. And what is the treatment? What do you do if somebody has prediabetes? We can advise them on lifestyle changes in the beginning, not using any medications. There are several studies that show that by losing even 7% of your total weight, you can improve the risk for developing diabetes. And also moderate exercise, about 150 minutes per week. That's about half an hour, 5 days a week. It's recommended. And like I mentioned earlier, in the natural history of diabetes, in the beginning, you have increased insulin resistance, your body is trying to produce more and more insulin, and eventually it exceeds the capacity and you start to damage your pancreatic beta cells which produce insulin. And that's where you start to notice that blood sugars are rising. And at that point, our goal is to try to keep blood sugars in normal range. And I'll go back to your point. That was a very good observation that whenever you have high level of stress, for any reason, it could be mental, could be physical, could be some kind of illness, heart attack, or pneumonia, or you are in the hospital for any reason, that increases your stress hormones. That will increase your cortisol, catecholamines. Even in the beginning, your stress hormones are high. Cortisol is a hormone produced by your adrenal, and it has a circadian rhythm. So you have high levels of cortisol in the morning. As the day goes by, it comes down. So cortisol increases your insulin resistance. So whenever you are sick, we give everybody sick day guidelines. If you are taking insulin, you will need to increase the amount of insulin you take during those sick days. And you will also drink more fluids, take your medication, check your blood sugar more frequently, because that's when you can go into diabetes ketoacidosis, or you may become extremely hypoglycemic. Those are the acute complications. So you may divide diabetic complications into 2 large groups, short-term, long-term. All of those complications that I've talked about earlier were the small vessel and large vessel complications, but acute complications can kill you suddenly. When they have hypoglycemia, they don't respond. Last week I was wearing a continuous glucose monitor, and every time I hit button, like it would touch 50s or 60s, it will start to rise on its own. I wasn't even correcting it. I didn't have orange juice or anything to make it go up. That's how your body normally should respond. But in a diabetic individual, all of those mechanisms don't work. All of the glucose that we store in our liver and in our muscles, it should help us back up whenever you are getting low in between meals. But that system doesn't work appropriately in diabetes. So if they are hypoglycemic and they don't feel it, that's very dangerous.
Doctor, I have one question.
Yes.
In fact, nowadays, doctors don't go for the fasting sugar. They depend on A1C. What is this A1C?
Yes, so hemoglobin A1C is your average blood sugars over the last 3 months. The finger stick blood sugars change all day.
Yes.
It fluctuates, depending on what you ate and when you ate it, depending on your activity level. A hemoglobin A1C is your glucose attached to the red blood cells. The red blood cells live for about 120 days. There are two types of blood cells, white and red. The red will bind glucose, and that's how you measure the hemoglobin A1C, which stays pretty constant for about 3 months because your blood cells will live for 120 days. So if you want to see if their glycemic control is improving, you will not be able to judge by hemoglobin A1C in just 2 weeks or 3 weeks. You have to give it a little bit more time because that's old information. Yes?
जो रोल वाइटामिन्स का रोल जो है वो डायबिटिक पेशेंट्स के लिए कैसा रहेगा, और दूसरी चीज़ ये है कि हम लोग जो देसी हैं इंडिया पाकिस्तान के लोग वो ये चीज़ें इस्तेमाल करते हैं, करेला, सिनेमान, कि ये खा लो और इससे जो है आपकी शुगर लेवल जो है वो डाउन हो जाएगी। मेरे ख्याल में ब्रैम्पटन और साग में सबसे बेहतरीन दवाई करेला ही है।
और भिंडी को भी काट के अगर
जी भिंडी
ये भी सुना है। आई डोंट नो कि इसका
तो क्या इसका कुछ रोल है या करते?
उसमें कुछ rats में studies हुई हैं अभी जिससे it shows there's some benefit, but some of those are just myths, and it's usually just fiber, pretty much. And okra is a low carb vegetable. Eggplant is a low carb vegetable. If we know which foods have carbohydrates, like we know potatoes have carbohydrates, rice and roti, bread, they all have carbohydrates. And then if you choose vegetables which are low in carbohydrates, of course, and especially they have high fiber, that will block the rapid absorption of glucose. So that's good for your diabetes, good for blood sugars.
And vitamins?
About vitamins, vitamins are important for everybody, and vitamins should be normal in all individuals. The only place I can think of vitamins is B12 and vitamin D. B12 can decrease in patients who have been taking metformin for a long time because it interferes the absorption of B12 from the gut. So, and that can also aggravate your neuropathy if you have it. So it's really important to check B12 and give supplements. If they don't absorb B12 from their stomach because of an autoimmune problem, then you might want to use sublingual or injectable or intranasal form of B12. The other vitamin that we check routinely is vitamin D, D as in dog, because vitamin D is linked to a lot of metabolic problems. Recently there has been a lot of research in this area, and if you have vitamin D deficiency, that increases your risk for having osteoporosis. And we know that diabetes also adversely affect your bone density, so they can compound and make it really worse. Other than that, all vitamins are important for everybody. They should be in normal range, and they will all cause different problems. Yes?
I have a question. Would fasting in any way help a person in delaying like in a pre-diabetic patient or something? Fasting.
Yeah. Short answer, if they do it safely, sure, yes. Yes. Are you talking about the Ramadan fasting or what kind of fasting?
No. In routine, if they want to fast for just like Mondays and Thursdays, because there is a study about some, I think some naturopath has done these kinds of studies or something like that, that fasting helps in for type 2 diabetes. So
yes.
Is there any relationship between the function of pancreas with fasting, how it works?
It works by reducing caloric and carbohydrate intake. So if you reduce the caloric intake, that's going to help improve your weight, that will help improve insulin resistance. Yes, that will help. And if it also cuts back the intake of carbohydrates, so your pancreas doesn't need to work as hard. So yes, intermittent fasting can help. So diabetes management is individualized. Yes.
Okay, why don't you finish off?
Okay. How do you manage diabetes? Diabetes is different for one person from the other, and the management treatment can differ from one day to the other. So it really needs to be individualized, and it needs to get teamwork with the provider and patient. Everybody has an individualized A1C goal. If it's a young person who has not developed complications, we shoot for 6.5%. Most adults, 7%. But if it's an elderly patient where hypoglycemia can be more harmful, you will shoot for 7 to 8%. And then patient education. We send every single patient to diabetes education, because education is Education is important for any disease, but it's especially important in diabetes. Lifestyle modification is the first step. Unless somebody walks in with 12% hemoglobin A1C and you need to put them on insulin right away. In general, you will start with lifestyle modification, talk to them about diet change, increasing physical activity. And it's also about comorbidity management. Diabetes is not just about blood sugars, but also the weight, the blood pressure, the cholesterol, to reduce their risk for morbidity and mortality. Okay, this is where I'll end my presentation, and if you have any more questions. Yes?
I just had a comment about, in terms of diabetes type 1 or type 2.
Yes.
It's obviously a physical manifestation, right, of something that's happened in the body. However, factors leading up to it, and maybe possibly knowing your body ahead of time in terms of prevention, possibly there's DNA testing going on, because those factors allow you to understand and plan. And there's a lot of modernization regarding this. Also, a lot of discussion is not there, and there's confirmation of this. Emotional, mental, spiritual factors are also there. When we look outside of our community and what's happening in terms of treatment and stuff, we need to come back and understand this to really understand and find out what's the treatment modalities. And I do believe that the value of some of our foods, some people mention okra and all these other things, they are valid because there's a lot of Western medicine that is taking this into consideration. And they're looking at these things to help, because food, nutrition is very impactful in terms of how our bodies are affecting hormonally all the time. So I think it's very important to look at your lifestyle, look at what kind of factors are causing your emotional, mental stress. It's also for children, and also you can add financial, psychological, and all of these other factors as well. It's an integrated process. So if you have areas of stress, try to minimize them. And then secondly, look at other options out there to be able to help support you. Because yourself as a practitioner, you're only going to give your feedback to help manage. But you need to understand that you need to go and find out your own self, what information is out there, and bring it back here to the community. Because we already have that. Diabetes is rampant for many, many years. But we need to see what are the factors that are leading up to it. And intergenerational issues are also there too. So those are all things that I've kind of come across that in terms of my research and further stuff that I'm going to be planning to do in my healthcare. So it's kind of good that you've kind of discussed this topic, because North America has a huge issue with the food, and we need to really see what kind of things can be impactful. And a lot of things are important.
Thank you for that.
Okay.
I have a
Yes?
question.
Yes.
These days, PCOS is very common in young girls especially, and it's increasing, and how it's related with diabetes.
Yes, very good question.
And
Yes.
one more thing, like metformin, most physicians,
Right.
it's controversial. Like some say that it's not helpful, some say it's helpful. So it is or it is not.
Okay. Yes, so 2 questions, very good questions, both of them. Polycystic ovarian syndrome is very common. It's one of the most common endocrine problems in women, and it's a syndrome. So if you go by the NIH criteria, you can diagnose PCOS by any 2 out of 3. You have your cysts on the ovaries, biochemical evidence, or hyperandrogenism if they have high levels of testosterone, and oligomenorrhea, irregular periods. So if you have any 2 out of these 3, you diagnose PCOS. And PCOS is different disease for where you are in your life. For a young person, it has different concerns. They have different concerns, and if you are in your fertile years where you're trying to have kids, your concerns will change. When you're older, your concerns change again. It has increased risk for cardiovascular problems. So yes, PCOS is one of the risk factors for developing diabetes, and these women should be checked for diabetes. The other question was use of metformin, whether it's helpful in PCOS and diabetes or not. It is very helpful. I treat PCOS all the time, and metformin is the mainstay of treatment. Metformin reduces your insulin resistance. It will help. It either helps you lose weight or is weight neutral, and it also lowers your testosterone levels. It's a treatment for high testosterone levels, which is also a problem in PCOS. It blocks the receptors. So you treat PCOS by birth control, by spironolactone, metformin, and also if they're concerned about facial hair, you can prescribe creams for facial hair.
These days, they're using some pens, like basically injected in the Ozempic.
right?
So is it helpful? What kind of side effects they have?
Oh, that's a huge drug class. That's
Yeah.
another talk in its own self. And we can talk about it some other time, but I can talk to you later about that. It's very helpful. I use those drugs every day. Yes? Yes?
Yes. There seems to be a little bit of misconcept among some people that type 1 and type 2 diabetes have connection. As far as I know, there is no, if somebody has type 2 diabetes, it's not, and type 1 is quite different from it.
Right.
Confirm that?
Yes, so it's a yes and no answer. So you're right that these are two completely different diseases. Type 1 diabetes happens because you are born with genes for it, and you have problems producing antibodies against your own pancreatic cells. You're attacking and destroying your own pancreatic cells. And by the time you are diagnosed, 95% of your beta cells are lost, and the remaining 5% are down the hill, and eventually your body doesn't have any insulin. And you are going to die without insulin. Before 1921, when we had insulin, people with type 1 diabetes lived for 12 months. That was their average lifespan. So if you had type 1 diabetes, that was a death sentence. And now you can continue to live because we have insulin. And type 2 diabetes is multifactorial. There is no one part of your genes which determines that you are going to have type 2 diabetes. It's both a genetic problem and a lifestyle problem. So some people are born with genes, but if they maintain an active lifestyle, they maintain their weight and they maintain healthy living, then they don't develop the disease. So they don't develop the phenotype, even though they had genotype. And some people don't have the bad genes, but their lifestyle is so poor that they develop type 2 diabetes.
Thank you.
Welcome.
I have a question.
Doctor.
sir.
Yes.
What about the latest medicine of Jordan? Is
Yes.
it better or it has
So
got
that's
more side?
another completely different class of drugs. It's completely new. It's the newest one, and it's
Yes.
amazing science, and I can talk to you about that later.
But
Yes.
is it better
Metformin?
than metformin? That's the point.
Better than metformin? I don't know. No.
No?
Metformin has lots of other benefits that Jardiance doesn't. But Jardiance also is showing some new data that metformin doesn't show. So yes and no.
ये
Yes.
मेटफॉर्मिन से रेजिस्टेंट होता है आदमी?
Metformin से क्या होता है?
If somebody is taking metformin for 10-20 years,
Yes.
does he get resistant to the metformin?
No.
No.
No, metformin continues to work. It's the nature of the disease that gets worse over time. It doesn't mean that metformin stopped working for you. It just means the job became bigger than metformin, and
Okay.
metformin needs help more. Makes sense? Yes?
Are you open to more naturopathic or natural foods that can help, or like nutrition? Like in addition to allopathic treatment? Do you advise that or no?
Only,
As long as it's
only which has data. Like
Yes.
we know that Mediterranean diet reduces,
Yes.
helps you with the weight and
Right.
reduces risk for metabolic syndrome. We recommend that. And only the dietary supplements that will be proven by data and they're approved by FDA, then yes. But in general, no. Like dietary supplements which have no data, we make no recommendations for or against them.
I'll have a chat with that.
Sure.
What's the threshold concentration of sugar at which you should start taking insulin? Threshold
Mhm.
6 or 7 or 8. When does it become really
When should you
the
start
cost
taking insulin?
benefits outweigh cost?
There is no one answer for that. It's individualized. So if somebody walks in and their hemoglobin A1C is 8% and they are taking 5 different oral medications, then yes, I'm going to start them on insulin. But if somebody walks in and it's a completely new patient who's not taking any medication and their hemoglobin A1C is 7.5 or 8%, we're going